Pretty much everyone has questions about sexual activity. As a man with a bleeding disorder, you most likely have some really important ones. Can I get a bleed just by having sex? Yes. You can get a bleed in any part of your body or in any joint, regardless of what sexual position you choose. But you can still be sexually intimate. Just be aware that a bleed can happen anywhere your blood flows, and sex can involve parts of the body that have a lot of blood vessels, including mouth, genitals, and anus. Anal sex poses a greater bleed risk, as it may lead to bleeding from mucosal lining. Using a condom and water-based lubricant to minimize friction may help avoid these types of bleeds. The purpose of having sex is to enjoy it, so work with your partner to find what works best for you. Having pillows and blankets nearby for support can help too. During sex, how will I know I'm having a bleed? What should I do? The signs and symptoms won't be any different than those of usual bleeds. The most likely types of bleeding that men face are bruises or hematomas, muscle bleeds in the calf or forearm, or a joint bleed. Signs and symptoms may not be visible right away. If you experience an injury during sexual activity, stop and follow your usual treatment plan as soon as possible to avoid the risk of long-term damage. Men should look for any injury to the penis, which may be marked by external bleeding, swelling, pain, and discoloration of the urine. There's a chance a psoas bleed could develop after having sex, and it may not appear immediately. The psoas is a large muscle located deep in the hip and groin area. Symptoms include inability to straighten your leg while lying back or not being able to stand up straight. If you suspect a psoas bleed or penis injury, treat it and contact your healthcare provider immediately. These bleeds can be serious. Medical providers have seen and heard it all before, so there's nothing to be embarrassed about bringing these situations up. Is it okay to masturbate? Masturbation is healthy and natural. It isn't unusual to have a bit of blood in your ejaculate or in your urine after masturbation. Your urine should be clear the next time you pee. If you have persistent pain or swelling, or if you continue to have blood in your urine, contact your healthcare provider. How do Viagra and other similar drugs work with bleeding disorders? Are there any complications? Prescription and some over-the-counter drugs should only be taken after consulting with your hematologist, because they're knowledgeable about how these medications could interact with your bleeding disorder. Certain rare side effects, including bleeding in the eye, swollen joints, and cloudy or bloody urine, could be increased by a bleeding disorder. How can I connect with my partner sexually when I'm experiencing symptoms due to my bleeding disorder? Depending on where and how severe your bleed is, bleeding doesn't have to stop you from being sexually intimate. If you're in pain, tell your partner. You can consider other sexual activities for you or your partner's pleasure, or you can engage in intimate activities with your partner, maybe sensual massage or cuddling. Connecting doesn't have to involve sex. For most, sex and intimacy is a big part of your overall well-being. Communication with your partner will help maintain a safe and healthy sexual experience. And remember, it's okay to ask any questions or bring any concerns to your healthcare provider. Find out more on our website, stepsforliving.hemophilia.org.